cystic fibrosis, it kind of put us in the place of what we were all going to live through as a society in those kind of lockdowns that we had, where you had to be very, very mindful of sharing public space with others. It's about protecting yourself, but also protecting everyone else. So, but like I said, the one key point I would say is that antimicrobial resistance is not just about pharmacology, it's about how we use and share space and our everyday routines.
Yeah, for me, I think what you're saying there is very much like what Vanessa was talking about earlier as well, about Vanessa, am I paraphrasing you correctly here when you were talking about your doctors were teaching you not just about how to take the right tablets at the right time, but how to keep everything really clean and what the best protocols were for using it?
Yeah. I think maybe a good word to use is a social determinants. You go home and you either clean your counter or you don't, or you change your lifestyle habits and so on. I mean, all these things basically work. So I guess it depends on the scenario. Are you an inpatient or are you an outpatient, and so on.
Yeah, very much so. Rebecca, did you have anything when you were talking to your family and friends about antibiotics?
I think as a researcher, when you aren't necessarily attached to a condition that you work on, you're moved on different elements. I wasn't really aware of antimicrobial resistance as much as I am now. And I have a partner who has had sepsis 3 times, and you think back and you go, oh, actually, maybe this is something we need to consider now, if it does happen again, whether you need to have conversations with your doctor around what antibiotics you're receiving, because we have no idea what antibiotics we received or what would happen moving forward. So it's really made me and my partner and family members think about being more of that patient advocate as well, and making sure you're aware of what's actually happening.
Yeah, for sure. Yeah. For sure. It's you suddenly, this whole world opens up, doesn't it? You suddenly go, how did I not know that? What, more people are going to die within 30 years? Within 30 years, think back 30. No, you get some of the undergrads now and they go 30. My daughter's 21 on Friday. It's right at the front of my mind. 30 years, oh, that's ages away. That's nothing. You're like, 30 years is nothing. Within 30 years, more people are expected to die from infections than die from cancer. That was, for me, that was one of my big wake-up call things. People often say, well, what is your passion? Why are you passionate about this? Why, okay, you do some research in it, but why are you passionate about it? And my auntie died from it wasn't a resistant infection, it was an infection that doesn't respond to antibiotics. There's a slight difference. And so she had something called C. difficile, and it's one of the adverse outcomes that can happen if you get antibiotics or you get too many antibiotics. So that was before I really knew very much about this. I'd done a microbiology degree, but I'd never heard of Clostridioides difficile before. And I know a lot about it now, and I lecture about it. It's antibiotics aren't just, antimicrobial drugs aren't just like fire and forget. They're not smarties. They do have adverse outcomes as well, and it isn't all just resistance. Yeah. Mark, was there anything that we've talked about there that's kind of flashed up in your mind when you talk to family and friends or other people about it and they go, really, I didn't know that?
I think for most people, when I talk about it, it's the whole idea that you can have resistances to antibiotics, and there's the whole minefield out there for resistance is quite surprising for a lot of people. People are just, they live their lives and they just think they can have whatever they want and get better, and they just carry on living their lives, and they don't think about what actually is out there that can cause problems. They just think ultimately if there's a problem, someone will sort it at some point down the line, and kind of sort of willful ignorance in a way, not in a demeaning way, just because they're not aware of it. It's just a lack of awareness. And I think that's the biggest thing when I, even come today, when I tell my parents, who are currently downstairs babysitting, say I've got this meeting about the resistance, and they were quite surprised that it was actually a thing that was big enough to have these sort of meetings.
Yeah, Vanessa and I were talking about this earlier, that this year for World Antimicrobial Awareness Week feels like the message is starting to get through into the media. People are starting to to click onto some of the messages, it's really exploded, and it's bigger and it's going to get more important. Negin, have you had any thoughts as we've been discussing this about those wow factors, those moments when people in your family and friends have suddenly clicked onto what you're saying?
Yeah, exactly. So I definitely, for sure, I can say I'm more aware than now, more like compared to maybe 7 years ago or like 6 years ago, because back in my country, I came from Iran, and I started my PhD like around 5 years ago. I started my master and then my PhD afterward. So I wasn't that much aware when I was back in my country, because it's really easy to get antibiotics everywhere, it was like even for getting a flu, you would easily get the antibiotics easily from the counter, or even some doctors prescribe the injection, like very high doses of penicillin, and sometimes it's just like people take it, but they don't feel good. I mean, after like 10 days of infection, still nothing is happening. And that was like, that's when I started thinking about, when I started reading about this kind of resistance, it's like, oh my God, that's very terrifying, because it's just people taking it. And I was talking to my family, like, we will have a discussion with a group of researchers that we're going to talk about like antibacterial resistances, that's such a important thing that seriously I'm telling to my family that please just don't take anything. It's just like in case you need it, like especially my nieces are young, and the impact is so huge, because even it's not only like okay, we stop taking antibiotics and the problem will be solved. It's like even the antibiotics can be found in the drinking waters as well. Like we can build up the resistance even without knowing it. And for like those countries that they don't have access to the clean water, that would be a very, very challenging problem. So it's like the impact is like beyond the explanation, but we have to really think that what could have as a kind of alternative to antibiotics, or tackle the bacteria or viruses in different way. That's what we're trying to figure out. Like for example, we use an implant which we don't use. It can have antibacterial properties, but not specifically with presence of antibiotics. It can interact with bacteria in different ways, or damage the cell membrane, bacterial membrane, in different way that the antibiotics does. And then bacteria is hard. It's something new environment for bacteria, and it's very hard for them to build up the resistance, because they never experienced something like this, and they might not easily, they kind of they get damaged physically rather than chemically. So I guess that's what we're trying to
finding new strategies, isn't it? Finding new strategies. So it's interesting you're saying this. I was talking to a patient not too long ago, and I looked at her date of birth when she was she came in checking her date of birth, and I just happened to pass a comment. She was 94 years old, and she was born the year before Alexander Fleming had his finding on his petri dishes of what he called at the time mold juice, which turned into penicillin and then turned into tablets. And she was born before he'd had that time, and then it took another 10 years from then, or more than 10 years, until penicillin came into use. So there are people alive today who were living and breathing, and we've all got ancestors who didn't have antibiotics.
Yeah,
we lived a different life, and she was telling me all the stories about how they used to go and bathe her wounds in salt water, because that was all that they had to do it, and they accepted a much higher, well, they were scared of infections, and they would avoid infections at all cost, and they were scared of them, and that's just something that isn't within our culture now. And I think that there are, as Rebecca's doing her work with the clinicians, and as Negin's been talking out there about back in Iran, there are places in the world where this isn't just about educating clinicians, this is about educating the public as a whole. And we know from looking on social media, or just from talking to people out and about, people don't always just get antibiotics from a prescriber, from a clinician. They get them from all over the place because they want them. They have a street value. They'll go and find them wherever they want to get them from. And it's how do we do that education? How do we change the culture? Did you know that here's another of my did you knows. In the Netherlands, people don't want antibiotics. You know, in the UK, people feel a bit hugged and squeezed, and it's like it's a caring thing. If I give you antibiotics, you feel like I've cared for you a little bit. And if I say you don't need antibiotics when you think that you do need them, then if I say no, it feels like I don't care for you. Actually, it's because I care so much for you that I'm not giving them to you, but it doesn't always feel like that to the patient. But in the Netherlands, people don't want them. Why is that? Why have they got such a different culture there to in the UK, and why do different countries use them so differently? There's so much work to do here, and for me, and the reason that I asked Mark and Vanessa to come and talk for us today is that when we're doing research and when we're moving forward, and I know that Rebecca has public patients involvement, and I know that Daryl and Negin have had patients involved with their research. As we move forward, it's about working with the public. So when we were talking to the University of Manchester network the other day, the lab bench type researchers were asking to talk to clinicians about what the right answers are. And I was pushing them to go even further and saying it isn't just clinicians you want to talk to, it's patients. People who've experienced this and who live it and breathe it are the ones who can really tell us where the focus needs to be. Yes, clinicians are important in that discussion as well. But if I can encourage everyone to use PPIE, experts by experience, whatever you want to call real people who live and breathe this every day, then I will do. And there are so many. And one other thing to ask anyone listening in, have a think about, as Negin just said there, think about the last time you know someone who had an infection that didn't respond to antibiotics. That was probably an antibiotic resistant infection. If I say to you how many people have had an antibiotic resistant infection, I bet none of you well, apart from Rebecca and Mark, Vanessa and Mark, sorry, I bet no one put their hands up and say, yes, I've had an antibiotic resistant infection. But last year, because we're in World Antimicrobial Awareness Week, the data from last year shows that 1 in 4 infections that went through the laboratories in the hospitals were resistant infections. One in every 4. That's massive, and it's set to grow. So antibiotic resistance isn't something that might happen to some people at some point in the future that people will die from. It's something that people live with here and now, and something that people die from here and now. And it's life-changing. And if we can avoid that, then that's great. And that's what the research is all about. So yeah, I'm passionate, you can tell that. I've got a message here from Ruth Hurley. Thanks. Hearing from people who've had infections have had a lot of impact. Thanks, Vanessa and Mark, for sharing. And absolutely, thank you all for taking part this evening. I think it's really important to listen to what people have to say, to share with each other. You know, the links between Vanessa's facial implants having an MRSA infection, and then Negin's research being about graphene oxide coatings for implants so that they don't get MRSA infections. You know, that's it, living and breathing. And I'm absolutely certain, Negin, that if you do more research on this and you want Vanessa to share her experiences with you, you know, Vanessa's part of the Get Vocal on AMR network, which I mentioned at the beginning, and Emily's just put a note in the chat as well about that. Then that's a really good way of getting through it. We have a full group of people, a full network of people, PPI, at University of Manchester and Manchester Foundation Hospitals Trust, who are there. You don't have to be based in Manchester, you can use them from anywhere in the country. It's a not-for-profit organisation. They insist that you pay PPI for their involvement. You know, people who volunteer their time, it's all well and good, but you know, they have lives to lead, and expenses. You know, they can't just keep volunteering their time because they're passionate about it. You know, we're paid, we're in salaried roles, they need to be paid too. And there are mechanisms for doing that, and Vocal will help you access those funding mechanisms to do it. Is there anything else that anyone would like to say or to share? I just really want to say thank you to everybody. I really, really appreciate your time this afternoon. And we've got lots of people coming up on the chat saying thank you as well. Alison from Antibiotic Research UK would love to talk further with Rebecca about her work. That they're doing some work with Well Pharmacy and getting messages out to patients. Thank you, everybody.
Okay, thank you. Brilliant. Thank you so much, Wendy. Thank you, everybody else, for taking part today. As I say, we have recorded this. We'll get the edited version across to you all in the next few days to share as you wish. Okay, thank you so much, Wendy. I will see you in a couple of days. Okay,
Yes,
thank you, everybody. Okay, take care. Have a safe day. Cheers.
Thank you so much, everybody. Take care. But and Mark and Vanessa, you've got the claim form, right?
Yes, thank you.
Yeah. I
Thanks,
emailed.
Wendy. Yeah,
Yeah,
don't
no
worry.
problems.
Thank you.
Excellent. Take care. Thank you so much. If any of the rest
Bye.
of you need Rebecca, Negin, or Daryl, you need any sort of like, I don't know, like, what's the word I'm looking for, like notes for your files or anything to say that you've presented in this forum, then let us know. We can